Akihiko Takeuchi, who's going to speak to us about epiphysis growth after epiphyseal-preservation surgery for childhood osteosarcoma around the knee joint.
Thank you for Chairman. Good morning, everybody. We developed two freezing methods in our department, and pedicle freezing method have advantage of to reduce the osteotomy site. And we indicate epiphyseal-preservation surgery for good radiological response to neoadjuvant chemotherapy and the thickness of residual epiphysis more than 10 millimeters after tumor excision. And the cases of no metastasis or resectable metastasis cases will expect a favorable prognosis. However, our question is the residual epiphysis is very thin, so is it possible to grow, especially in transverse growth? So the purpose of this study is to analyze epiphysis growth of residual epiphysis after frozen autograft in childhood osteosarcoma around the knee. This case included a 12 patient, 3 boys and 9 girls. Mean follow-up was 63 months, and the mean age was 11. 8 cases were distal femur and 4 were proximal tibias. 7 cases were treated by free freezing method, and 5 were pedicle freezings. And one case of stage 3 were included in these studies. And there are 3 types of osteotomy line around the epiphyseal plate: transmetaphyseal osteotomy, and transphyseal osteotomy, and transepiphyseal osteotomy. And we measure the epiphysis width as shown in this slide. And we can only measure the medial half in the proximal tibia due to the shadow of metal. And we also analyze the epiphysis growth compared to the postoperative radiograph to the final follow-up. And we also measure the epiphysis width discrepancy. And we evaluated the limb length discrepancy, union time, limb function, and complication and management, and oncological outcome. Mean epiphysis growth was 12.7%, and the mean epiphysis width discrepancy was 0.1 millimeters, so no discrepancy for transverse growth. This case is 10-year-old girl proximal tibia cases, transepiphyseal osteotomy. And after 37 months, we can observe the 20% transverse growth. And the mean limb length discrepancy was 26 millimeters, and we performed lengthening in 3 cases. And this case is an 11-year-old boy, distal femur case, transepiphyseal osteotomy. After 38 months, the limb length discrepancy apparent, so we performed tibial lengthening, but the transverse growth were preserved for 80%. This case is a 60-year-old girl, transmetaphyseal osteotomy case. After 66 months, limb discrepancy were apparent, so we performed the tibial lengthening, but good transverse growth were obtained. So mean union time were 9 months, and mean MSD score was 28, and the oncological outcome CDF11 and NAD1, and there are 8 complications in 3 fracture, 1 recurrence from soft tissue and a superficial infection, but no collapse of epiphysis. And all complications were managed by further additional treatment. In discussion, this report from KC from Hong Kong, they reported excellent limb function after the epiphyseal preservation surgery. And they showed 1 case of residual epiphysis growth. So our study is the first case series to show the residual epiphysis growth after joint preservation surgeries. But this study has some limitations. A small number of patients, relatively short follow-up periods, and the growth of residual epiphysis evaluated by the two-dimensional lateral growth only by using X-ray radiographies. So in conclusions, epiphysis transverse growth was not diminished, and there was absence of epiphysis collapse even after epiphysis preservation surgery in this small series. Epiphysis preservation surgery shall be possible and could be an alternative method worth considering. Thank you for your attention.
Thank you very much, Dr. Takeuchi.